Hi, I'm Christopher Patino, APRN at VidaVital Medical. One of the biggest differences between medically supervised care and many online hormone or weight loss programs comes down to one thing: lab work. Today, I want to explain why labs matter, what they tell us, and why starting treatment without proper testing can put patients at risk. Many patients come to us after being offered hormone therapy or weight loss medications online with little or no lab testing. That can be appealing. It feels fast. It feels convenient. But medicine isn't supposed to be guesswork. Hormones and metabolic treatments affect multiple systems in the body, and without diagnostic data, providers are essentially treating blind. Lab work gives us a real picture of what's happening inside the body. It helps us understand hormone levels, metabolic function, cardiovascular risk, and how different systems are interacting. For hormone therapy, labs allow us to evaluate testosterone, estrogen, thyroid function, and markers that influence how a patient will respond to treatment. For medical weight loss, labs help identify insulin resistance, metabolic issues, and underlying conditions that can impact safety and results. Symptoms matter, but symptoms alone don't tell the whole story. Fatigue, weight gain, low motivation, or brain fog can come from many different causes. Without lab work, it's impossible to know whether symptoms are driven by hormones, metabolism, inflammation, stress, or another medical issue entirely. Treating symptoms without data increases the risk of incorrect treatment and missed diagnoses. One of the biggest concerns with many online clinics is that treatment protocols are often standardized. Patients are given similar medications or dosing without comprehensive diagnostics or ongoing monitoring. At VidaVital Medical, lab work guides every decision. We use diagnostics to determine if treatment is appropriate, what treatment makes sense, and how it should be adjusted over time. That's the difference between convenience-based care and medical care. Hormone therapy and weight loss medications are powerful tools, but they're not risk-free. Without lab monitoring, changes in blood counts, cholesterol, blood sugar, or hormone balance can go unnoticed. Ongoing labs allow us to adjust treatment early, protect long-term health, and ensure patients are actually improving, not just losing weight or chasing a number. Another important point is that lab work sometimes shows that treatment isn't needed at all. Some patients improve symptoms by addressing sleep, nutrition, stress, or other hormone imbalances first. Responsible medical care means knowing when not to prescribe something, and that decision should always be based on data. Lab work isn't a barrier to care, it's a safeguard. It allows treatment to be personalized, adjusted, and monitored safely over time. If a clinic is willing to prescribe hormones or weight loss medications without proper diagnostics, that's a red flag. Medical treatment should always be guided by data, not shortcuts. At VidaVital Medical, labs guide our care because patient safety and long-term health always come first.